Did you know that clogged arteries can lead to heart attacks? Well, it's time to dive deep into this mystery and unravel the complex world of our cardiovascular system. Our journey begins with the arteries, these remarkable vessels tasked with the important job of transporting oxygen-rich blood from our heart to every corner of our body. They're like the superhighways of our circulatory system, facilitating the vital delivery of nutrients and oxygen to our hard-working cells. But what happens when these highways get congested? Just like a bustling city during peak hour, things slow down. And in the case of our arteries, this traffic jam can lead to some serious health complications. You see, over time, substances like fats, cholesterol, and calcium can accumulate on the inner walls of your arteries. This buildup, often referred to as plaque, can harden and narrow the arteries, a condition known as atherosclerosis. Now imagine a river. When it's free-flowing, it's a marvelous sight to behold. But what if a dam were to obstruct its course? The water would start to pool, the pressure would rise, and eventually it could burst its banks. This is similar to what happens when our arteries get clogged. The blood flow becomes restricted, leading to increased pressure on the heart. And when the heart has to work harder, it's like running a marathon without any training. It puts a strain on this vital organ, increasing the risk of heart disease and, in severe cases, causing heart attacks. Atherosclerosis is a silent condition, often showing no symptoms until a serious medical event occurs. This is why understanding the mystery of clogged arteries is so important. It's a silent threat that could be lurking within any of us. But don't worry, it's not all doom and gloom. There are ways to prevent and even reverse arterial plaque buildup. Now that we understand the seriousness of clogged arteries, how do we unclog them? Stay tuned as we delve into the causes of clogged arteries and explore the steps we can take to keep our arteries and our hearts healthy. Before we dive into unclogging arteries, it's essential to know what causes them to clog in the first place. So let's pull back the curtain and uncover the main culprits behind this widespread health issue. First and foremost, a poor diet is a major player. Consuming foods high in saturated fats, trans fats, and cholesterol can lead to the buildup of fatty deposits in the arteries, a condition known as atherosclerosis. These deposits narrow the arteries, restrict blood flow, and can eventually lead to heart attacks or strokes. Foods like fast food, processed meats, and sugary drinks are prime examples of dietary offenders. Next, let's talk about exercise, or rather the lack of it. Regular physical activity helps keep the heart and blood vessels healthy. It reduces the levels of harmful cholesterol and increases the good cholesterol, promoting better blood flow. When we lead a sedentary lifestyle, we're essentially rolling out the red carpet for clogged arteries. Moving on, smoking is another significant factor. It's not just bad for your lungs, it's a nightmare for your arteries too. The chemicals in tobacco smoke damage the lining of your arteries, leading to an accumulation of fatty material that narrows the artery. This is why smokers often have a higher risk of heart diseases. Lastly, we can't ignore the role of genetics. Some of us, unfortunately, are dealt a bad hand when it comes to heart health. If you have a family history of heart disease, high blood pressure, or high cholesterol, you are at a higher risk of developing clogged arteries. However, it's important to remember that genetics is not destiny. Lifestyle changes can go a long way in mitigating these inherited risks. So there you have it: poor diet, lack of exercise, smoking, and genetics. These are the main actors in the drama of clogged arteries. But here's the good news: once we know our enemies, we can start to fight back. Now, armed with this knowledge, we can start to combat these causes and unclog our arteries. One of the key players in unclogging our arteries is what we eat. Yes, you heard that right. The power to keep your arteries clear and healthy lies right on your dinner plate. So let's take a dive into the world of foods that can help us unclog our arteries. First up on our list are fruits and vegetables. These nature's candies are packed with antioxidants, which help to fight off oxidative stress and inflammation in our bodies. Imagine them as your body's personal cleaning crew, scrubbing away at the plaque in your arteries. Two of the most powerful antioxidants are vitamin C and E, found abundantly in citrus fruits and leafy green vegetables. Next, we have lean proteins. These are your body's building blocks, helping to repair and maintain your tissues, including your arteries. Foods like fish, chicken, and tofu are excellent sources of lean protein. Not to mention, fish also contains omega-3 fatty acids, which are known to reduce inflammation and lower blood pressure, further helping your arteries stay clean and clear. Don't forget about whole grains. They are a rich source of dietary fiber. Think of fiber as a sponge, soaking up the bad cholesterol in your bloodstream and carrying it out of your body. Foods like oats, brown rice, and whole grain bread can be your best friends in your journey to unclogged arteries. Lastly, let's talk nuts and seeds. They are a powerhouse of healthy fats and fiber. Almonds, walnuts, flax seeds, and chia seeds can lower your bad cholesterol levels while raising the good ones. But remember, while these foods are beneficial, it's important to consume them as part of a balanced diet. You can't just eat a handful of almonds and expect miracles. It's about making consistent, healthy choices. By incorporating these foods into our diet, we're already taking a big step towards unclogging our arteries. So, the next time you're at the grocery store, remember to pick up some of these artery-friendly foods. They not only taste good, but also do good for your heart. Exercise isn't just for weight loss, it's also a powerful tool for unclogging arteries. Now you might be wondering, how does breaking a sweat help keep your arteries clear? Well, it's all about getting your heart pumping and your blood flowing. When you engage in physical activity, your heart beats faster to supply more oxygen-rich blood to your muscles. This increased blood flow helps to keep your arteries flexible and open, preventing the buildup of plaque that can lead to clogged arteries. Regular exercise can also help lower bad cholesterol and increase good cholesterol, further protecting your arteries. So what types of exercise are we talking about? Well, the good news is, there's a wide range to choose from. Aerobic exercises like jogging, swimming, or biking are great for getting your heart rate up and improving blood flow. Strength training can help lower bad cholesterol and raise good cholesterol. And don't forget about flexibility exercises like yoga or Pilates, which can help lower stress levels, another key factor in heart health. But what if you're not a gym goer or a marathon runner? Don't worry, even moderate activities like taking a brisk walk, gardening, or dancing around your living room can make a big difference. The key is to find something you enjoy and make it a regular part of your life. Aim for at least 30 minutes of moderate intensity exercise on most days of the week. And remember, it's never too late to start. Even if you've never been active before, taking that first step towards a more active lifestyle can have a significant positive impact on your arterial health. So whether you're a fitness enthusiast or just starting out on your fitness journey, remember the power of physical activity in keeping your arteries clear. It's not just about looking good, it's about feeling good, living longer, and most importantly, living healthier. So remember, keep moving to keep those arteries clear. Along with diet and exercise, making a few lifestyle changes can go a long way in unclogging arteries. Let's delve into some of these changes that can have a profound impact on your heart health. Firstly, consider quitting smoking. Smoking is a major culprit behind clogged arteries. It reduces the amount of oxygen in your blood, causing your heart to work harder and increasing the risk of blood clots. When you quit smoking, you're instantly reducing your risk of heart disease, and over time your body begins to heal, reversing some of the damage caused by smoking. Next, let's talk about stress. Chronic stress can contribute to a buildup of plaque in the arteries. While it's impossible to completely eliminate stress from our lives, we can certainly manage it better. This could be through mindfulness practices like meditation, yoga, or even just taking a few minutes each day to relax and unwind. It's about finding what works for you and making it a part of your daily routine. Maintaining a healthy weight is another crucial lifestyle change to consider. Excess weight often leads to high blood pressure and cholesterol levels, both of which can contribute to clogged arteries. Even a small reduction in weight can have a significant impact on your heart health. Incorporating a balanced diet and regular exercise into your routine can help you achieve and maintain a healthy weight. Lastly, don't underestimate the power of sleep. Adequate sleep is essential for your body to repair and regenerate. Lack of sleep can lead to higher levels of stress hormones and inflammation in your body, which can contribute to clogged arteries. Aim for 7 to 9 hours of sleep each night for optimal health. By making these changes, you're not only unclogging your arteries, but also improving your overall health. Remember, every small change you make can add up to a big difference in your heart health. So, start today and pave the way to a healthier, happier heart. Sometimes, despite our best efforts, medical intervention may be necessary to unclog arteries. This doesn't mean you've failed. It simply means that there are additional tools at our disposal to help ensure your heart's health. Let's delve into some of these medical treatments. First off, we have medication. Doctors often prescribe drugs like statins, beta blockers, or nitroglycerin to help reduce cholesterol levels, lower blood pressure, or alleviate chest pain. These medicines can slow the progression of plaque buildup and sometimes even reverse it. Next, we have angioplasty, a procedure where a small balloon-tipped tube is inserted into a blocked artery. The balloon is inflated to widen the artery, and often a small wire tube called a stent is left in place to keep the artery open. This procedure can be a lifesaver, restoring blood flow and reducing symptoms like chest pain and shortness of breath. Then there's bypass surgery, or coronary artery bypass grafting. This is a major operation where surgeons create a new route around a blocked artery using a vessel from another part of your body. While it's an invasive procedure, bypass surgery can greatly improve blood flow to your heart and significantly reduce the risk of a heart attack. However, it's important to note that these treatments are not without risks and side effects. Medications can cause a variety of side effects, from muscle aches to liver damage. Angioplasty and bypass surgery, being invasive procedures, carry risks of complications like bleeding, infections, or even heart attacks. So, while these medical interventions can be incredibly effective, they are not a substitute for a healthy lifestyle. They are tools to be used in conjunction with diet, exercise, and other lifestyle changes to keep your heart healthy and your arteries clear. Remember, it's crucial to consult with your healthcare provider to determine the best course of action for you. Your journey to heart health is unique, and only a medical professional can provide the guidance you need to navigate it successfully. Let's quickly recap what we've learned about unclogging arteries. We started our journey by diving into the mystery of clogged arteries, understanding how these silent killers work their way into our lives. We learned that it's not just about age or genetics, but a multitude of factors that contribute to this condition. A situation often exacerbated by modern lifestyles, leading to a global health crisis. From there, we uncovered the causes of clogged arteries, which include high cholesterol, high blood pressure, smoking, diabetes, and sedentary lifestyle, among others. We found out that these factors, when combined, can lead to atherosclerosis, a condition where plaque builds up in the arteries, leading to potential heart attacks or strokes. Next, we explored the powerful role that diet plays in unclogging our arteries. It's not just about avoiding unhealthy foods, but actively incorporating heart-healthy items into our meals. Foods rich in omega-3 fatty acids, plenty of fruits and vegetables, lean proteins, and whole grains can all contribute to cleaner, healthier arteries. We also looked at the power of physical activity. We learned that regular exercise doesn't just make you feel good, but it also keeps your arteries healthy by increasing your HDL, good cholesterol, and reducing your LDL, bad cholesterol. It doesn't have to be a grueling gym session. Even a brisk 30-minute walk 5 days a week can make a significant difference. We delved into the necessary lifestyle changes for healthier arteries. We discovered that quitting smoking, maintaining a healthy weight, managing stress, and limiting alcohol intake can all contribute significantly to unclogging arteries. It's about making those small, consistent changes that add up over time to create a big impact. Finally, we discussed possible medical interventions for severe cases. We learned about medications, surgeries, and procedures that can help when lifestyle changes and diet aren't enough. But remember, these should always be the last resort, and prevention is always better than cure. The journey to unclog your arteries isn't a sprint. It's a marathon that requires dedication, discipline, and consistency. But the rewards are immense. Not only can you potentially add years to your life, but the quality of those years can be significantly improved, giving you the vitality and energy to live your life to the fullest. So, let's commit to making these changes today. It's not about perfection, but progress. Start small, stay consistent, and over time, you'll see the results. Your heart will thank you for it. Remember, a healthy heart starts with unclogged arteries. If you found this video helpful, don't forget to like, subscribe, and check out our other videos for more health tips.